Okay. So once again, good afternoon, everyone. So hopefully you're doing well. Okay, so for day class, we will be discussing Module 2, which is all about the cardiovascular, renal, and hematological disorders, and of course, the drugs associated with each conditions. Okay, and the first topic class we will be discussing will be about hypertension. Okay, so first question, class, before we proceed any further, what is hypertension, or how do you understand, class, high blood pressure? Right? Anyone can answer this. You can type in the chat box. Mababasa ko naman yon. Or you can unmute yourselves, class. Or raise your hands so that I can acknowledge you. Ano ang hypertension? Ano nga ba ang meron sa high blood? Bakit ba lagi natin sinasabing dapat to solusyonan? Well, not really cure, but manage. It's impossible to cure hypertension. Okay, Mr. Dio, hypertension is having high blood pressure. Okay, ano ang risk? Bakit kailangan siyang i-manage? Tama yon. Pag may hypertension ka, generally, class, in every waking hour of your life, mataas ang blood pressure mo. It's usually above the normal one. Right? Pero kasi minsan, class, may question lagi dyan eh. What is normal? Ang normal ba sa'yo ay normal din sa akin? Kasi di ba medyo subjective yan eh. Paano kung malaki yung katawan ko? Expected na mataas talaga ang BP ko on a daily basis compared to people who are smaller. Right? Pero we were able to establish through scientific evidence na at least ito ang range considered to be normal for a regular human being. Okay, so in hypertension class, you go beyond the established normal range. Okay? Pero sabi nga natin, again, that's still very subjective. So anyway, hypertension daw having high blood pressure. Ano ba class ang risk kapag laging mataas ang BP natin? So tama yun. So hypertension, so let's write that down. Elevated, We need to manage hypertension because it can cause cardiovascular complications. Very good, Mr. Dio. Okay? Generally, class, halos lahat ng sakit cardiovascularly nagmumula sa elevation in blood pressure. Okay? So isipin natin, class, pag tumataas ang BP natin, kadalasan, class, ang blood vessels natin yung napapahamak dito. Okay? It can cause heart attacks. Very good. Okay? It could aggravate people to having heart attacks. Very good. Okay? So, tama yun. So, it could lead to so many cardiovascular problems. So, sige, before we further define hypertension, class, let's first discuss what blood pressure is. Okay, ano ba ang BP? So, BP, class, is simply the outward pressure of blood against blood vessel walls, and it's the product of blood flow from the heart and the inward resistance of the blood vessel walls. So, meaning, class, every time na magpapump yung puso natin, it exerts an outward pressure going into your blood vessels. Now, ang blood vessels natin, class, are elastic. Okay? It's elastic by nature. Para siyang goma. Okay? Nag-stretch yan. Tapos kasi pag nag-stretch yan, di ba bumabalik naman siya sa original shape niya? Okay? Normal yon. Ang pag-stretch, class, ng ating blood vessels, yung capacity niya to stretch because of the pressure that is exerted on it, okay, we call that, class, peripheral vascular resistance, or PVR. Yan, vessel resistance, or what we call the PVR. Peripheral vascular resistance. Okay? So, both the blood flow, okay, and the peripheral vascular resistance, class, dictates what the blood pressure is. Okay? So, imagine it this way, class. Anong nangyayari sa BP mo kapag ang iyong blood vessels ay constricted? So, dalawa lang naman kasi yung class. Either dilated. Okay, so ito yun. This is dilated. Tapos meron din naman, constricted. Assuming, class, this is a cross-section of your blood vessels. Now, between the two, class, which one do you think will produce a higher pressure? Okay, is it when the blood vessels are dilated or when the blood vessels are constricted? Sino yung nagpo-produce ng higher blood pressure? Very good, Mr. John. Okay, kapag constricted yung ating blood vessels. Isipin nyo, class, na-try nyo ba magdilig ng halaman? Okay? Di ba nagdidilig tayo ng halaman, may hose tayo. Sabihin natin walang nozzle yung hose mo, regular hose lang. Kunwari wala tayong pera. So, pero may garden kayo, no? Anyway, class, isipin nyo lang meron kayong garden hose. Di ba? Pag on mo ng faucet, right? Kung walang nozzle, yung inyong hose, free-flowing lang yung tubig. Okay, free-flowing lang yung tubig. Now, class, habang nagdidilig ka, halimbawa, malayo yung halaman, tinatamad kang maglakad papunta doon, di ba iniipit nyo lang yung hose? Pag inipit nyo, class, yung hose, ano napapansin nyo sa tubig na lumalabas? Okay, kung mapapansin nyo, class, para siyang, ano nangyayari? Pag inipit ko yung hose, natatakpan ko ng konti yung, yung butas ng hose. Anong mapapansin nyo, class, sa lumalabas na tubig? Ang hirap pa lang, mas lumalakas po yung lumalabas na tubig. No pressure? Okay? So, kasi kung mapapansin nyo, di ba, pag pinigilan mo ng halimbawa, half close mo, close mo, sumisirit yung tubig, di ba? Mapapansin nyo yun. Similarly, class, ganun din kasi ang nangyayari sa blood vessels natin. Kapag lumiit, class, yung daluyan ng ating dugo, okay, mas sumisirit yung dugo palabas. Kapag sumirit, class, yung dugo palabas, anong pwedeng mangyari dito? Okay? Well, obviously, class, tumataas yung pressure. Alright? Kung naalala nyo sa physics, di ba? The smaller the area, the higher the pressure produced. Okay? So, same thing, class, happens to our blood vessels. So, every time na lumiliit, class, yung daluyan ng ating dugo, okay, mas sumisirit yung dugo. At pag sumirit yung dugo, class, lumalakas yung pressure build up. Kaya tumataas ang blood pressure natin. Okay? So, mahirap magsulat ngayon dito sa PowerPoint. Right? Hope you don't mind. Basta ako saglit. Okay? Dito tayo sa aking So, assuming, class, this is the blood vessel. Sorry. So, BP, so sabi natin, class, it's simply the amount of blood flowing. Okay? So, we call that as cardiac output. Okay? Multiplied to your PVR, or the peripheral vascular resistance. Remember, class, peripheral vascular resistance, ito yung resistance na pinuproduce ng ating arteries. Okay? Now, kailan usually tumataas ang PVR? Normally, tumataas to if there is vasoconstriction or there is occlusion in the artery. What do I mean when I say occlusion? Okay? So, assuming, class, ito kunwari yung ating blood vessel. Cross-section ulit tayo. Okay? Ito yung normal. This one's the normal. Na pag yan, class, ay constricted, obviously, lumiit yung daluyan ng dugo. So, kung yan ang daluyan ng dugo, so, usually, pag malapad, maganda. Okay? Free-flowing lang yung dugo. Dito, class, sobrang constricted yan. Dahil constricted siya, there is build-up of pressure. At dahil sa build-up of pressure na yan, tumataas yung BP. Okay? Na pwede kong constricted. Now, what if, class, hindi naman constricted to? Nagkaroon ng occlusion. Now, class, what do we mean when we say occlusion? Did anyone mention? What do we mean when we say occlusion? Dapat S yata to. Joke lang. Ba't ko sinulat na T? Occlusion. Okay, occlusion, class, or may bara. Okay, question. Ano ang usual na bumabara sa ating arteries? Ano yung madalas na dahilan ba't nagkakaroon ng bara sa arteries natin? Pwedeng blood clots. Very good. Very good, Mr. Dio. That's one. Ang pinaka-common, class, na nagbabara sa ating arteries. It's your blood vessels is yung pinagdadaanan ng ating arteries. Cholesterol or fats. I'll take that, Mr. Bato. Mr. or Miss De La Cruz. Okay, Flery. Miss, okay, Miss De La Cruz. Thank you very much. Okay, so it would usually be your fat deposits. Okay? Usually in the form of low-density lipoproteins. Okay, so class, pag nagkaroon ng fat deposits dito, alright, sabi, kunwari, cross-section ulit Pag nagkaroon ng fat deposits dito, anong sa tingin nyo mangyayari sa bukasan ng ating arteries? Di ba lumiliit kahit hindi siya nagko-constrict? Okay, kahit hindi nag-constrict yan, class, lumiliit yan. Now, let's make it worse. Lagyan natin ng blood clots. Okay? Kunwari, ito, lagyan natin blood clot. Yan. Alright? So, halimbawa, meron na ng taba, may namuo pang blood clot. So dahil sa namuong yan, ano nangyari sa daluyan ng tubig, daluyan ng dugo? So nagkakaroon class ng build up of pressure ulit. Thus, tumataas ang, well, BP generally, pero tumataas ang peripheral vascular resistance. Increase in PVR. So normally class, an increase a PVR, okay, yung vascular resistance, okay, is usually caused by either vasoconstriction or an occlusion within the arteries itself. Alright, which leads to an increase in your blood pressure. Now, what about cardiac output class? Ano bang meron sa cardiac output na yan? Cardiac output class, ito yung kadalasan na minimension natin kapag either bumibilis ang tibok ng puso mo, okay? Kasi class, ano nangyayari kapag mabilis ang tibok ng puso? Di ba mas forceful yung heart natin? Di ba parang yung pag kumakabog yung dibdib natin, yung parang luluwa na yung puso natin sa dibdib natin, okay, yun, tumataas yung heart rate natin, di ba? At kung mapapansin mo class, malakas yung pressure na ini-exert ng ating puso. Kapag tumaas daw ang heart rate nating class, posibleng tumaas din ang BP. Okay? Or, tumaas ang blood volume. Tumaas ang blood volume. So, ano ibig sabihin ng pagtaas ng blood volume? Ibig sabihin, dumadami yung dugo natin. Okay? So, kumbaga, yeah. Generally class, tumataas ang blood volume. So, kung babalikan natin class yung example natin kanina na garden hose. Okay? Pag inipit mo yung garden hose, di ba? Sinara mo ng konti. Okay, ang lakas ng build-up ng pressure, ramdam mo yun sa daliri mo, di ba? Nagkakaroon ng build-up ng pressure. At the same time, sumisirit yung tubig. Na class, sabihin natin, hindi mo pinigilan yung, hindi mo binarahan yung, yung butas ng, or yung butas ng hose. Pero instead, class, sinagad mong buksan yung gripo. Okay, di ba? Pag sinagad mong buksan ng gripo, tumataas yung volume. At ano mapapansin mo sa pag-agos ng tubig? Mas lumalakas din. Okay? So basically, class, there are two parameters. Okay? May dalawang bagay na nagdidikta kung paano tumataas or bumababa ang BP natin. At yun ay yung cardiac output at yung peripheral vascular resistance. Now, class, kung mapapansin nyo sa equation na to, it is directly proportional. Ano ibig sabihin nun? Kapag tumaas ang cardiac output, tataas ang BP. Pag tumaas ang PVR, tataas ang BP. Pag tumaas itong pareho, cardiac output sa PVR, talagang tataas yung BP mo. Sigurado yon, garantisado. Na kapag bumaba ang isa dito, bumaba ang PVR. Okay, halimbawa, nakakonstrict yung blood vessels, in-induce ko ang vasodilation, pwedeng bumaba ang BP. Okay, so halimbawa, bumaba ang PVR, may posibilidad class na bumaba rin yung blood pressure. Kahit hindi ko in-address yung cardiac output. Maliwanag ba tayo doon? Okay. So, I hope that's clear so far. Okay? Pero basically, class, ano ba ang blood pressure? Okay. Okay. So, sabi nga natin, blood pressure is just simply blood pressure is simply, again, the outward force exerted on your blood vessels. Alright? Okay. Now, ano ang nangyayari kapag ang isang tao ay may hypertension? Okay, so by definition class, ang hypertension daw is a persistent diastolic BP greater than 90 mm of mercury and a systolic BP greater than 140 mm of mercury. Okay? Try lang natin kung naalala nyo pa. Anong pinagkaiba ng systolic sa diastolic? Okay? What is the main difference between a systolic blood pressure from a diastolic blood pressure? Ang pinagkaiba nga ba ng dalawang ito? Yun is the highest pressure in the arteries during contraction while diastolic is the lowest pressure between contractions. Okay, I'll take that. Okay? So normally class, kapag titingnan mo isang tao may hypertension, sa tingin nyo, saan tayo mas tumitingin? Sa systolic or sa diastolic? Mr. Neil. Sa tingin mo lang. Systolic. Okay, Mr. Dio. Right, very good. Kadalasan kasi titingnan natin systolic kasi yun yung pressure na lumalabas kapag nagko-contract yung BP, yung ating puso. So, kung mapapansin nyo, class, every time that the heart contracts, okay, tingnan yung, ang pusong ito. Dito tayo tumingin. Yan. Right? So, every time, class, the heart contracts, okay, pag nag-push out siya ng dugo dito, right, boom, ganyan. Diba, sasaluin yan ng arteries natin. So, sabi nga natin, class, ang blood pressure is the amount of blood entering the blood vessels and the resistance that the blood vessels provides. So, syempre, class, pag push ng dugo natin ganyan, okay, nag-push yung puso natin, so yung arteries natin, lolobo. Okay? Pero dahil stretchable si arteries, palitan natin ng kulay. So dahil stretchable yung arteries natin, kukontrahin niya yun. Okay? Kukontrahin niya yung pag-angat niya. Alright? Yun yung tinatawag natin peripheral vascular resistance. So, depende sa amount of blood entering, yung force ng blood entering, at the same time, the resistance that the arteries are producing dictates what your blood pressure is. So, that's usually measured by the systole. Diastole, class, ang pressure na natitira kapag ang dugo, kapag ang puso mo ay nag-relax. Okay? So, kumbaga, systole, diastole. Systole, diastole. Okay, alam ko hindi nyo nakikita yung kamay ko, pero panoorin nyo na lang, class, yung video nito afterwards. Okay? Yan. So, American Heart Association says that as long as your systolic blood pressure is greater than 140 and diastolic pressure greater than 90, then you're classified as someone with hypertension. However, class, in recent days, in recent times, binabaan na nila to. Okay, in recent data, instead of greater than 140 daw, greater than 130, classified ka as someone with hypertension. Pag ang systolic blood pressure mo raw ay nasa 120 palagi, you're classified as pre-hypertensive. And you might want to consider daw, class, lifestyle adjustment na when your blood pressure is like that. Okay? So some facts about hypertension. Epidemiological studies indicate that a strong correlation between blood pressure and cardiovascular morbidity and mortality. Ibig sabihin, you can, may positive correlation daw between hypertension and cardiovascular conditions. In Asia Pacific, 66% of cardiovascular death can be attributed to hypertension. Okay, cardiovascular diseases would include stroke, MI, angina, heart failure, kidney failure. All of these things daw, class, can be related to hypertension. And 90% of hypertension is essential or primary, meaning namamana natin. Okay, antihypertensive drugs greatly reduces the risk of cardiovascular events and death. Now, okay, so let's try to think of it this way, class. Okay, how does hypertension cause cardiovascular diseases? Okay, paano ba siya nag-lead to cardiovascular disease like strokes, MI, okay, kidney failure, heart failure? Okay, think of it this way, class. Let's try to illustrate this. If this is your blood vessel, class, if this is our blood vessel, yeah, then sabihin natin, class, may paparating na pressure. Okay, a positive pressure. Tumaas yung cardiac output. Ayan. So, syempre, may pressure yan. Tapos, syempre, ang ating katawan din, ang ating blood vessels, okay, kukontrahin yun, yung PVR. Alright? Now, imagine it this way, class. What if araw-araw na ginawa ng Diyos, malakas ang pressure sa ating arteries, sa lining ng ating arteries? Ano sa tingin nyo mangyayari, class? Lagi na lang parang binubugbog ito ng mataas na pressure. Okay? Ano sa tingin nyo, class, ang pwedeng mangyari sa ating arteries? Puputok kung sobra-sobra, tama yon. Pero class, huwag kayong mag-alala. Bago pumutok yan, talagang worst case scenario na yung pumutok. Okay? Pero normally, class, sabi natin, araw-araw na ginawa ng Diyos, lagi na lang mataas ang pressure sa ating arteries. Okay? Ang usual nangyayari dyan, class, nagkakaroon siya ng maliliit na sugat. Kasi na-overstretch yung ating arteries. Di ba, class, pag ang lastiko, ang goma, pansinin nyo, paulit-ulit yung banatin. Okay? Paulit-ulit yung banatin. Di ba parang nagkakaroon ng maliliit na sugat? Okay? Parang nagkakaroon ng tears. Right? Isipin nyo lang yung class, pag araw-araw na binabanat yung ating ugat, parang goma lang din yan. Nagkakaroon siya ng maliliit na sugat. Ang problema kasi class sa mga maliliit na sugat na yan, dahil sugat siya, pwedeng dumugo. Tama? At kapag may pagdurugo, ano ang nabubuo? Okay? Anyone? So, nagkakaroon tayo ng maliliit na sugat dito. Kasi nga, lagi siyang binubugbog ng mataas na pressure. Pwedeng magkaroon ng bleeding, di ba? At kapag may bleeding class, ayan, kunwari, dumudugo na yan. Pero napakaliit lang yan class, hindi mo mapapansin yung pagdurugo na to. Dahil sobrang liit niyan. It's just a microscopic, hindi ko masabing microscopic talaga, pero maliit na sugat lang yan class along the blood vessel linings. Now, dahil nagkakasugat yan class, okay, so yun na, may maliliit na bleedings, pero dahil may dugo, may pagdurugo, okay, kahit isipin nyo, dugo naman talaga dumadaan dito, no? Pero dahil may maliliit na pagdurugo dyan class, pwedeng makabuo ng maliliit na blood clots. Now, okay lang sana kung maliliit na blood clots araw-araw na ginawa ng Diyos class, mataas lagi ang BP mo. So dahil mataas lagi ang BP, so maraming sugat-sugat yan maliliit, may namumuong blood clots, hanggang dumating ang punto class wherein, yung maliliit na blood clots, unti-unting lumalaki. Nagets ba class? Now, pag lumaki pa lalo to class ang blood clot na to, ano sa tingin niyo pwedeng mangyari sa BP natin? Dahil lumalaki yung blood clot. Ano nangyari sa BP? Okay? Habang lumalaki yung blood clot, very good, Mr. Dio, lalong tumataas ang BP natin. So, class, dahil nabuo yung blood clot na yan, lalong tataas ang BP. Now, isipin nyo, class, okay, isipin natin. What if, class, andito kunwari yung kidneys natin? Alright? Ito yung ugat na nagsusupply ng dugo sa ating kidneys. Okay? So, class, dahil lumalaki yung blood clot na yan, may blood clot. Tapos itong flow ng dugo, pag ganyan na. Ano tingin nyo kasi nangyayari sa pressure nito? So, obviously, sabi natin, mataas yung pressure. Okay, sabi nga, tumataas ang BP, di ba? Tapos kasi yung pressure na yan, tinatamaan yung kidneys natin araw-araw. Tinatamaan ang kidneys natin ng mataas na pressure. Ano sa tingin nyo mangyayari kay kidneys? Pag araw-araw siyang binobombitan ng mataas na pressure. Okay? Nagde-deteriorate. Very good. Or nasisira. Isipin mo lang, class, halimbawa, meron kang garden hose. Okay? Tapos, i-bombit mo yon sa mata mo. Okay? Tama ba yung term ko, bombit? Right? Basta yung garden hose, kunwari, gawin ito example. Tapos, pigilan mo yun, tapos itapat mo sa mata mo araw-araw. Di ba? Mabubulag ka dun, right? Same thing, class, sa mga organs natin. Kaya nga, class, napakadelikado ng pag napapabayaan ang high blood. Kasi, class, at the end of the day, sisirain ng high blood. Okay? Pag lagi mataas ang blood pressure mo, sisirain nun yung mga organs natin. Example na nga, kidneys. Pangalawa, class, retina ng mata natin. Okay, may mga blood vessels tayo sa mata. Kaya class, ang high blood pwede rin magdulot ng pagkabulag. Okay? Now, ito pa yung worst case scenario. What if yung namuong blood clot dito? Paano ulit nabuo yung blood clot na to? Nabuo ang blood clot na to dahil araw-araw mataas ang blood pressure. So, nasugatan yung arteries, nagdugo, dahil may pagdurugo, nagbuo ng blood clot ngayon. Kasi yung blood clot naman, ang goal niyan ay para mapigilan yung pagdurugo. Okay, yun na naman ang purpose ng blood clot, right? What if, class, yung blood clot na to na-dislodge? Okay? So, yung blood clot na yan, ito na. Na-dislodge. Right? Lagyan natin ng border para maganda tingnan. Yan. Okay, so let's call this dislodge blood clot. Okay? Ano sa tingin nyo, class, ang risk kapag yung blood clot na yan na namumuo sa ugat na to ay biglang natanggal? Okay? It becomes an emboli. Ano ang risk, class, ng mga emboli? Anyone? Okay, sabihin natin class yung emboli na to pumunta sa arteries ng utak. Okay? Or sabihin natin class pumunta sa coronary arteries natin. Okay? Ano pwedeng mangyari dito? Okay? Yung blood clot na yan, na dislodge, okay? Umikot-ikot sa dugo natin. Tapos bigla siya class napunta sa utak, sa arteries ng utak natin. Anong kalalabasan nun? You get? O sige, it's okay. Class, venous thromboembolism. Yun yung example class ng ano ha. Yun yung example ng sakit that can produce an emboli. Venous thromboembolism. Very good. Okay? Venous thromboembolism, nagmumula yan sa lower peripheries. Sa lower extremities natin, like the legs. Okay? Habang halimbawa, di nagagalaw yung legs mo, so namumuo yung blood clots. Okay? Tapos yung blood clot na yan, namuo, pwedeng ma-dislodge, pumunta sa utak. Okay? Ang end product kasi nito, class, pag itong blood clot na to, okay, itong blood clot na yan, ito, pumunta sa utak nating class, pwede ito mag-lead sa stroke. Okay, kapag itong emboli na to pumunta naman sa coronary arteries natin, meaning sa ugat ng puso natin, heart attack naman ang kalalabasan nito. Now, we'll have a separate discussion class about heart attacks within module 2. Okay? Pero basically, class, saan nagmula yun? Anong punot dulo ng lahat ng to? Dahil lang sa anong kondisyon lang ang nagdulot ng pagtaas ng stroke, heart attacks, nagkaroon ng damage sa kidneys, okay? Pwede mag-lead sa pagkabulag, and so on and so forth. Anong punot dulo ng lahat ng to? Hypertension. Very good. Okay, dahil hindi mo na-control ang blood pressure mo. Okay? Now, class, tandaan niyo ito ang high blood class, hindi naman agad-agaran lumalabas hindi siya agad-agad nagmamanifest. Right? So, I hope mas naiintindihan nyo ako kasi pag tinatagalog ko to I prefer teaching this subject in Tagalog. Kasi feeling ko mas naiintindihan ng mga estudyante kapag nagtatagalog ako. Wala naman ditong spokening dollars? Wala naman. Meron ba tayo ditong foreigner? Sorry, do we have a foreigner here? Someone who doesn't understand Tagalog? None? Okay, do we have? I think most of you are Filipinos naman, right? Last time when I saw you guys. Okay, so mukhang lahat naman kayo ay Tagalog. Okay. So, mukhang di man tayo magkakaproblema pag nagtagalog ako dito. Sometimes, minsan kasi class, may mga estudyante akong foreigners. So, kinakailangan ko siya ituro in English. Okay? Pero anyway, since lahat naman tayo dito Tagalog, wala tayong magiging problema. So, class, naging punot dulo nito is dahil sa laging pagtaas ng BP natin. Nagdulot ng pagkakasugat ng ating arteries. At the same time, pwedeng pabataas lagi ang BP, nataas lagi ang blood pressure, sinisira ang ating mga organs. Okay, like the kidneys, okay, mata, and so on and so forth. At hindi lang yun, dahil sa hypertension, pwedeng magdulot ito ng pagbuo ng mga blood clots na pwedeng kapag siya ay na-dislodge, lumaki, pumunta sa utak, stroke ang kalalabasan. Pumunta sa ugat ng puso ko, heart attack naman ang kalalabasan. Right? So, maliwanag ba? Okay. Slideshow. Play from her slides. Okay. Oops. Okay. So, class, sabi nga natin, the only way, class, you can manage hypertension, right? The best way for you to manage hypertension is, of course, proper diet, exercise. Diba? Ang daling sabihin, ang hirap gawin. Okay? Kahit sino ang sabihan mo niyan parang wala. Okay? Sabihin mo sa matanda, mag-exercise po kayo. Tatama rin yan. Okay? So, what's the next best thing? Di kaya mag-diet, di kaya mag-exercise. And then we go to antihypertensive drug therapy. Okay? Naggagamot tayo para ma-manage yung BP. So, sabi nga natin, normally daw, pero this is old. Okay, I should have changed this. May mas bago na. May mas bagong categories na for hypertension. Okay, so ang normal daw dati is less than 120. Nowadays, ang normal is sa 110. Normally, kapag nasa 120 ang BP mo, class, it's classified as pre-hypertension na. Anyway, so 120 to 139, and so on and so forth. Hindi ko na babasahin to para sa inyo. Pero basically, class, nag-uumpisa tayong maggamot, kadalasan ha. Okay, well, again, depende rin naman to sa doktor mo eh. Right? Normally, pag stage 1, okay, inuumpisahan ka na maggamot. Lalo na pag stage 2. Pag stage 2 na yan, class, hindi lang isang gamot para sa high blood ang ginagamit mo. Combination therapy ka na dyan. And so hypertension is known as the silent killer. Why? Because no symptoms arise unless BP is severely elevated. Okay? Ito ang lagi nyong tatandaan, class. Minsan may mga matatanda, di ba? Sabihan mo na, uy, tay, nay, ang taas ng BP mo, ba't di kayo nagagamot? Anong sagot nila? Di ba kadalasan sasabihin ng mga matatanda, hindi naman masama pakiramdam ko eh. Ba't ako magagamot? Okay, lagi yung sabihin, class, na kapag mataas ang BP ng isang tao, madalas walang simptomas yan. Wala ka talaga mararamdaman. Pag may nararamdaman ka ng pananakit ng batok, mga ganyan, or sumasakit yung ulo, ibig sabihin, class, may problema talaga yan. Okay, hindi lang dahil mataas ang BP mo yan. Matagal nang mataas ang BP mo, sobrang taas lang talaga ngayon. Okay? Kasi kadalasan nga, class, hypertension is known as the silent killer. Kasi pwedeng tumaas ang BP mo nang wala kang nararamdaman. At kadalasan, pag may naramdaman ka na, talagang malala na yung taas ng BP mo. Okay? Yan. Kapag ang BP naman, class, ng isang tao umabot na sa 180. Okay? Dito. So 180 over 110. Greater than 180 over 110. It's classified as hypertension crisis. Ibig sabihin, class, ito yung kondisyon kung saan dapat dinadala mo na agad yung pasyente mo sa ospital para mabigyan siya ng paunang lunas. Okay? Maliwanag ba tayo doon? Okay. Now, ano ang kadalasan na dahilan, class, pa tayo nagkaka-hypertension? One is pheochromocytoma. Pheochromocytoma, class, ito yung kondisyon kung saan may tumor sa adrenal arteries, sa adrenal glands natin. Adrenal glands. Okay, at dahil sa tumor na to, nagkakaroon, dahil adrenal ang target ito, there is excessive release of norepinephrine or epinephrine. Okay? So dahil may tumor, yung adrenal glands, it causes excessive norepi release. Alright? Okay, that's pheochromocytoma. Okay, next one is obesity. Now, class, why do you think obesity can cause hypertension? Maliban sa pwede, sir, kasi may fat deposit sa ating arteries. Okay? Kung malaki, class, ang katawan mo, ano sa tingin mo ang gagawin ng puso? How will the heart react to a person whose body is large? Mabigat po kasi yung body mass, kaya mas mahirap yung puso. Very good, Mr. Dio. Okay? Mas hirap siyang mag-pump. Okay? Dahil malaki ang katawan, mabigat, okay? Yung puso mo, class, doble kayod siya ngayon. Okay? So, may hirapan yung puso mo mag-pump. Dahil pump siya ng pump. Dahil malakas lagi ang pump niya kasi malaki ang katawan natin. Okay? So, dahil pump siya ng pump, tumataas yung cardiac output natin. Kung saan, pag tumaas ang cardiac output natin, epekto nito ay pagtaas din ng ating, blood pressure. Alright? Next one is renal artery stenosis. Pag sinabi natin, class, stenosis, ito yung pagliit ng arteries. Okay? Pero ito, very specific, ha? Ang pagliit ng arteries daw ay nasa kidneys natin. So, stenosis is narrowing. At ang sabi natin, kapag lumiit ang arteries natin, nag-narrow, ibig sabihin nag-constrict. At pag nagko-constrict yung arteries natin, sabi natin tumataas ang PVR na nagdudulot ng pagtaas ng blood pressure. Alright? So class, kung medyo nalilito pa kayo, huwag kayong mag-alala, naka-record tong lecture natin, balik-balikan nyo lang. Okay, para mas naintindihan natin. Okay? Another cause could be Cushing's syndrome, Cushing's disease. Cushing's, class, is a condition wherein nagkaroon ng excessive release ng cortisol. Okay? Cortisol, class, is your steroids. Right? Increase release in cortisol. Cortisol kasi, class, we'll have a separate topic about this actually. Okay, pag-uusapan natin to sa endocrine disorders. Pero cortisol is basically class your steroid hormone. Another name class for cortisol is your stress hormones. Okay? Okay. Kaya nga class, kung manonotice nyo, di ba? Minsan pag sinasabi natin pag na-stress ang isang tao, tumataba. Okay? Kasi nga class, dahil yun sa cortisol. Cortisol kasi class can cause so many complications. Masyadong marami to. Pero generally class, nakakataba kasi yung cortisol. Yun na lang. Okay? Nakakataba siya. So, similarly, Cushing's disease can lead to obesity. At na-explain natin kung bakit nagkakaroon ng pagtaas ng BP ang obesity. Plus the fact class that cortisol kasi is also a hormone that can cause an increase in heart rate. Right? Hindi lang yun. Nagkakos pa yan ng water retention. Water retention na yan can increase your blood volume. Which in turn also increases blood pressure. Mamaya pag-usapan natin ng mas masinsinan. Right? And then lastly class would be coarctation of the aorta. Okay, coarctation class, ibig sabihin ito yun. Pagliit lang naman ng aorta natin. Dahil nga lumiit yung daluyan ng dugo. Okay, lumiliit yon, so tumataas ang pressure dahil sa increase in peripheral vascular resistance. Okay? Maliwanag ba tayo doon? Okay, so ano ba yung mga komplikasyon na dulot ng hypertension natin? Okay, so hypertension class can cause congestive heart failure, coronary artery disease, ito ischemic stroke, nabanggit ko na ito kanya, di ba? Paano siya nag-cause ng stroke? Right? Coronary artery disease class, ito yung nagkakaroon ng bara sa ugat ng puso. Okay? Talagang tinagalog ko na pati yung ano, no? There is, may production ng may occlusions. Occlusions in the coronary arteries. Alright? There are occlusions in the coronary arteries. Now, sabi nga natin class, kapag may bara kasi yung, yung coronary arteries natin, lalo pag nalagyan ng blood clot yan, okay, it's going to lead to, a CAD can lead to MI or heart attacks. And a heart attack class can lead to CHF. At the same time, CHF can lead to cardiomyopathy. Next time natin pag-usapan to. Alright, pero basically class, connected kasi lahat ng ito. Okay? Retinal disease, na-mention ko to kanina. Meron tayong blood vessel sa ating retinas, sa retina ng ating mata. Na kapag yan class ay lagi mataas ang pressure, pwedeng niyang sirain yung retina natin. Diba? Sabi nga, parang yung sa hose. Araw-araw mataas ang pressure. Aneurysm. Ano naalala nyo class sa aneurysm? Okay. Aneurysms class is a condition wherein may pumuputok na ugat. Ito yung sabi ko sa inyo kanina, worst comes to worst. Kapag ito ang ugat natin, tas may bara, may bara dyan halimbawa. Tas totally na-close mo to. Okay? So, saan sa tingin nyo pupunta yung pressure ng dugo na to? Pupunta yan sa blood vessels. Okay? Dahil close na to Nagkaroon ng blood clot, sabihin natin. So, class, yung blood vessel mo dito, lolobo yan. Dahil sa sobrang lakas ng pressure na nagbe-build up. Okay, lolobo yan. Now, minsan, class, pwede yan dumating sa punto kung saan hindi nakakayanin ng arteries mo yung pressure. Anong mangyayari sa kanya? Puputok siya. Pag yan ay pumutok, pak! Ayan na. Pumutok yung ugat. Nagkakaroon ka ngayon ng hemorrhaging, internal bleeding, somewhere in your body. Pwedeng sa utak, okay, pwedeng sa may aorta, aorta, tama. Okay? Kahit saan pwede mangyari ang aneurysm So pag yan ay pumutok, magkakaroon ka ng internal bleeding, pwede mo 'to ikamatay. Okay? Pero common class ang aneurysm sa utak kasi maliliit lang yung arteries natin diyan. Maninipis lang. Mabilis pumutok, kumbaga. Okay? So, yan. Okay, meron pala akong ganito. Okay, aneurysm yan, paglobo ng ating ugat. Kasi may bara. Okay, and cardiomyopathy. Or yung pagkapal ng linings ng ating puso. Right? So, sabi ko sa inyo class kanina, ang blood pressure natin is dictated by your cardiac output and your systemic vascular resistance or your peripheral vascular resistance. Now, ano-ano yung mga bagay, class, na nakaka-apekto sa hypertension? Okay? Balikan natin yung image natin kanina. So, ulitin ko lang to, class, ha. Erase all na. Okay. So, sabi natin, class, blood pressure is equal to cardiac output times peripheral vascular resistance. Okay. So, ang cardiac output natin, class, is dictated by increase in heart rate. So, heart rate, o di kaya, class, blood volume. Alright? So, sabi natin, class, pag sabi natin blood volume, okay. Bakit pala na? So, it's dictated by your heart rate and then your blood volume. And then, ang PVR naman, class, is dictated by vasoconstriction or artery occlusions. Okay? So, artery occlusions, class, can be either fat deposits or blood clots. Okay? Yan. Vasoconstriction, well, normal naman yan eh. Alright. So, what happens, class, in hypertension? So, in hypertension, there is an elevation in BP. So, ang elevation in BP na to could be due to either an increase in cardiac output or an increase in PVR. So, class, anong normal or anong usual cause ng pagtaas ng heart rate natin? Okay, kailan tumataas ang heart rate natin? So, ang heart rate natin, class, pwedeng tumaas due to obesity. Sabi natin to kanina. Okay, kasi mas lumalaki ang katawan natin. Or sympathetic activation. Subukan nga natin. Class, ano ang nangyayari kapag tumataas or na-activate yung sympathetic nervous system natin? Okay? Ano nga bang nangyayari pag active ang sympathetic nervous system? Okay? Anong hormone nga ba yung tumataas pag activated ang sympathetic nervous system? It is your... Anyone? Anyone? O, sige, hamon na nga. Okay, di ba, class, sabi natin, kapag active ang norepinephrine, okay, norepinephrine, na stimulate ang beta-1 receptors which causes an increase in your heart pumping, excuse me, and so on and so forth. So basically, class, pag na-activate ang sympathetic nervous system natin, it can cause, yun na nga, okay, what do you call this? An increase in your heart rate. Alright? So it causes increase in heart rate. What about blood volume, class? Blood volume, okay, is usually due to water retention. Okay? Pag nagkakaroon tayo ng water retention, ibig sabihin na iipon yung tubig sa ating katawan, it leads to an increase in blood volume. Right? Tumataas yung blood volume natin. So, maliwanag ba tayo doon? Okay. So, all of these things, class, can lead to an increase in blood pressure, which by definition, class, can cause hypertension. Right? Now, balikan natin dito. Sa sympathetic activation, class. Okay? Ano ang mga pwedeng sakit na pwedeng mag-cause ng increase or activation of our sympathetic nervous system? Well, one condition, class, involved here is pheochromocytoma. Okay? So, di ba, ang sabi natin, pheochromocytoma causes the activation of the sympathetic nervous system. Pwede ring beta-1 receptor stimulation. Okay? That also causes an increase in sympathetic activation. Right? Marami pang iba dyan, class. Pero let's discuss other conditions. Atherosclerosis. Isa itong uri ng sakit, class, kung saan nagkakaroon ng deposits ng taba along our arterial lining, causing occlusions. Okay? So blood clots, whatever, okay? And so on and so forth. What about water retention? Normally, nangyayari ito if you have kidney problems. Nagkakaroon ng pamamanas. Now, class, pag meron tayong pamamanas or may problema tayo sa kidneys, it causes water retention. At ano expected natin pag nagkaroon ng water retention? Tataas ang blood volume, tataas ang cardiac output, kaya tumataas ang BP, which could lead to hypertension. Kaya kapag may problema ka, class, sa kidneys, kadalas, malamang sa malamang, okay, it could lead to hypertension. Okay? Kadalasan, it leads to hypertension. Okay? Maliwanag ba tayo doon? Okay, yung vasoconstriction, madalas naman talaga nangyayari yan sa katawan natin. Minsan nagko-constrict, nagdadilate. Pero sa mga dahilan kung ba't tayo nagkakaroon ng vasoconstriction is because of alpha-1 stimulation. Okay, which causes vasoconstriction. So I hope, class, you were able to read naman or you were able to understand our ANS. Okay? Kasi, class, napaka-importante ng ANS. Alright, I can't stress this enough. ANS, class, is the backbone of pharmacology. Kaya hindi lang dapat siya minememorize, siya ay inuunawa ng maigi. Okay? And so on and so forth. Now, these are just some of the conditions, class, that can affect blood pressure or hypertension. Pero there's another one, class, that is very significant. We call this the RAAS. The renin. Oh, shoot, kasya ba ako dito? Okay, sige. Excuse me. Okay. How do I move tapos? Dito na lang tayo. Yan. Bahala na. Okay yan. Renin, angiotensin, aldosterone system. Okay? Or this is something, class, we call as the RAAS. Oops, tayo. Hanggang dyan na lang ako. Okay, sabihin hanggang dito lang daw ako. Ay, fine. Okay. Familiar ba kayo, class, sa RAAS? Are you guys familiar with the term RAAS? Kinda? Not really? Okay, palitan natin blue na lang. Okay. The renin-angiotensin-aldosterone system, class, or also as the RAAS. Okay. Ang nangyayari ito, class, is more on the kidneys. Okay, more on the kidneys. Kidneys, class, are the most sensitive organ na mawalan ng sila yung pinaka-sensitive. Wherein, nagre-react sila, class, sa absence of oxygen or absence of blood. Okay? So, normally, class, pag ang kidneys natin is well supplied with blood, okay, normal lang siya. Pero if there is a reduction, okay, there is, sabihin natin, negative blood supply. Now, ano yung pwedeng mag-cause ng negative blood supply? Pwedeng ito due to occlusions. Okay, occlusions such as fat deposits in the kidney arteries, or pwedeng blood clots. Okay, which is again something that causes artery occlusion here. Okay, so basically, class, basta nag-cause yan ng decrease in blood supply, sa ating kidneys, anong ginagawa ng kidneys natin? The kidney starts to produce renin. Alright? Renin. Okay? Now, normally, class, one of the things that produces renin is beta-1 receptors. So, when you stimulate beta-1 receptors, it produces renin. Okay? Pero basically, class, ano bang ginagawa ng renin? Renin kasi, class, is a substance that converts angiotensinogen to angiotensin 1. Si angiotensinogen, class, madalas itong makita sa liver. So, kailangan ko si renin dyan para ma-convert si angiotensinogen to angiotensin 1. So, this is found in the liver. Now, si angiotensin 1 class on its own is inactive. This is inactive. Hindi siya gumagana. Inactive siya. Si angiotensin 1, kailangan ma-convert into angiotensin 2 para siya ay maging active. Right? At ang gumagawa class ng angiotensin 2 is your ACE. Or what we call the angiotensin converting enzyme na galing naman sa ating lungs. Right? So, kailangan mo si ACE para ma-convert si angiotensin 1 to angiotensin 2. Now, anong nangyayari class kapag active na si angiotensin 2? Balik tayo dito. Pag si angiotensin 2 class ay tumaas na, ay active na, it does a lot of things. One class, okay, it causes vasoconstriction. Number 2, it causes release of epi and norepinephrine. Okay. Next, it causes the release of aldosterone. Now, si aldosterone naman class on the other hand causes sodium retention. Pag nagkaroon tayo ng sodium retention class, it leads to water retention. Okay? So basically, yun siya. So what else? Now, dahil class, ito nga pala, dito tayo sa increase of epi and norepinephrine. This one naman class results to an increase in heart rate. Now, if you'll notice something class, okay, if you'll notice something, ano ang end result class kapag na-activate si angiotensin 2? Tingnan nyo causes vasoconstriction, increase heart rate, water retention. Ano ang end goal ng tatlong ito? Ano ang magiging epekto ng tatlong ito? Anyone? Okay. Anyone? Anong end result? Kapag nagkaroon ng vasoconstriction, tumaas ang heart rate, nagkaroon ng water retention, it causes edema. Yung water retention causes edema, tama ka doon. Pero pag pinagsama-sama ko yung tatlong effect na to, may vasoconstriction, tumaas ang HR, heart rate, tumaas ang water retention, ano magiging effect nito sa katawan natin? Very good, Miss Kiambao. It leads to hypertension. Or actually, hinanap ko ng tagay ito is an increase in blood pressure. Now, sa tingin nyo, bakit ang final effect ni angiotensin 2 is increase in blood pressure? Kasi tingnan nyo, class, ano ba ang dahilan ba't na-produce si angiotensin 2? Ba't nga ba nag-produce ng angiotensin 2 ang kidneys? Ano ang dahilan? Okay? Anong dahilan, class? Okay, ba't na-produce to si angiotensin 2? Okay? So if you'll notice, class, kaya lang naman na-produce si angiotensin 2 ay dahil nakulangan sa blood supply yung kidneys natin. Kasi class, pag tumaas ang blood pressure, ano sa tingin nyo mangyayari sa blood supply papunta sa kidneys? It is expected na, ano mangyayari sa blood supply? Lalong kukonti or lalong tataas? Bababa ba o tataas? Pag tumaas yung BP natin. Sorry, ulitin ko ha. Class, kapag tumaas ang blood pressure, right? Ano sa tingin nyo mangyayari sa blood supply papunta sa kidneys? Okay? Kapag tumaas ang blood pressure, ano mangyayari sa blood supply papunta sa kidneys? Tataas ba or bababa? Very good, Mr. Edward. Tama, Edward. Okay, tataas ang blood supply. Kasi class, lahat ng ito, ginagawa lang naman ng kidneys natin para tumaas ang blood supply. Kasi nga, mababa ang blood supply papunta sa kidneys. Pero ang aftermath niyan, class, ay dahil nagkaroon ng vasoconstriction, tataas ang PVR, tataas ang BP. Increase heart rate, tumaas ang cardiac output. Water retention, tumaas ang blood volume. Okay? So, maliwanag ba tayo dito, class? Okay, lahat yun nangyari lang simply because mababa ang blood supply sa kidneys. Kaya sabi ko sa'yo, napaka-importante ng kidneys, class, when it comes to the management of our blood pressure. Okay? So, pag-manage ng ating blood pressure. We'll talk more about this as we go on. Pero let's go back here. Okay. From current slide. Yeah. So, ito yung sasabi ko sa inyo kanina, class. Okay, when it comes to the RAAS, the renin-angiotensin-aldosterone system. Right? Pero na-explain na rin naman natin to. Let's proceed na lang muna. Okay, so main complications ng mataas na BP. Sabi natin, pwede yan mag-lead to stroke. Oops. Okay, pwedeng magdulot to ng stroke dahil nga sa formation ng blood clots. Okay? Elevated sugar levels, class, is usually due to diabetes. Okay, not necessarily high blood pressure. Diabetes can cause high blood pressure. Okay? Hypertensive retinopathy, myocardial infarction, or what we call the heart attack. Okay, which leads to heart failure. Okay, and then anyway, lastly, class, any damage to your kidneys can lead to nephropathy. So yun na yun. Okay? So now, ano ang therapeutic goals natin? Normally, class, when you have hypertension, okay, we need to manage three things. Okay, you need to manage blood volume, you need to manage the cardiac output, or reduce peripheral vascular resistance. Okay, so by doing this, class, we can limit the development of subsequent organ pathology. Now, why should you treat hypertension? Because sabi nga natin, class, blood pressure is directly related to cardiovascular and overall mortality. So, kapag na-manage mo kasi, class, ang BP ng isang pasyente, expect mo na marami tayong maiiwasang cardiovascular disorders. Sabi ko sa inyo, iisa-isahin natin yon as we go on with Module 2. Pero, class, ang pinaka-punot ugat talaga ng karamihan ng problema natin sa puso ay dahil laging mataas ang blood pressure natin. Right? Small reductions in blood pressure is associated with significant reductions in cardiovascular risks. Okay? Yeah. So, ano ang mga gamot, class, na kadalasang ginagamit natin for hypertension? Okay, so we have diuretics, beta blockers, ACE inhibitors, CCBs. Others include centrally acting sympatholytics, peripherally acting sympatholytics, selective alpha-1 receptor blockers, and vasodilators. Either of the two, pwede natin gamitin. Now, balikan natin, class, yung figure natin a while ago. Okay? Anong color maganda? Orange na lang. Okay. Right. Sige, class. Bigyan niyo ako ng gamot, class, na ginagamit natin for high blood. Anyone? Okay. Anong alam niyo ang gamot na ginagamit natin pang high blood? Losartan. Very good, Mr. Magno. Ano ang classification ng Losartan, class? Losartan is? Ano nga ba classification niya? So, tama yon. Yes, Miss Alnea. Losartan and Mr. Edward. Ano ang category niya? Sige, never mind. Okay lang yan, ha? Losartan. Dito tayo. Losartan. Yun. It's not an alpha-2 receptor antagonist. It's an angiotensin 2 receptor antagonist. Okay, very good. Okay, angiotensin 2 receptor, ha? So, sige, okay, fine. Baka yun ang inibig mo sabihin. I was thinking of alpha-2 receptors. Alright, Miss Lyra. Okay, baka sabi mo is angiotensin 2 receptor antagonist. Yes, very good. Okay, so ibig sabihin, class, ang losartan, tina-target niya ay angiotensin 2. Pag pinigilan mo si angiotensin 2, mawawala yung vasoconstriction, mawawala yung increase in heart rate, mawawala yung H2O retention, which again could decrease blood pressure. ACE inhibitor, sino ang target niyan? Obviously, class, ito. Di ba sabi natin, ang kailangan ng angiotensin 1 para ma-convert to angiotensin 2 is the ACE enzyme. By using ACE inhibitors, kinapipigilan natin yung pagbuo ng angiotensin 2. Okay? Ano pa ang mga gamot, class, na isip ninyo? Na ginagamit for, tawag dito, hypertension. Okay? Well, na-mention natin kanina, class, di ba? Diuretics. Para saan nga ba, class, ang diuretics? Para saan ang diuretics natin? Okay. Ay, wait lang. Baba ko pala itong image ko. Yun. Okay. Very good, Mr. John. Okay, ang diuretics, class, ay ginagamit nating gamot para pampaihi, pampababa ng blood volume. So, kadalasan, class, ginagamit ang diuretics to reduce the blood volume. Alright? So, what else? Ano pa bang mga inaisip nating gamot dyan? Okay? Beta blockers, right? Okay, example sa mga beta blockers, class, metoprolol, acebutolol, atenolol, lahat ng yon. Okay, lahat ng olols natin. Right? Di ba kasi ang beta blockers, kadalasan, nagpapabagal ng tibok ng puso. Now, hindi lang yun kasi ang ginagawa ng beta blockers, ha? Remember si renin? Renin is produced by beta-1 receptor activation. So, beta blockers, kaya niya ring bawasan yung levels ng renin natin. Okay? So, saan pa? Ano pa ba ang mga natin? Saan pa target ng ating beta blockers? So, pretty much that's it. Ito, sorry. Beta blockers. Beta blockers. Okay? Reduces sympathetic activation. Okay? Kaya, madalas siyang gamitin din for high blood. Okay? Ano pa, class? Ano pang naisip natin? Okay, good. Okay. Other medications, class, would include prazosin. I don't know if you still remember this, pero prazosin, any drug that ends in zosin, is an alpha-1 blocker. So, it causes vasodilation. And what else? Lagyan natin vasodilators. Whoops! Ayan. Vasodilators in general. Ang target niya, class, would be yung vasoconstriction here. Okay, amlodipine, very good, Mr. Tolentino. Sorry. Mr. Tolentino, amlodipine, which is a calcium channel blocker. Now, class, hindi lang siya basta calcium channel blocker. It's a second generation calcium channel blocker. So, amlodipine. Dahil siya ay second generation CCB. Ano ba yan? Okay? It's actually class A, vasodilator. So, amlodipine, class, causes vasodilation. At dahil nagdadilate ang blood vessels natin, bumababa ang BP. Okay? Ano pang naisip nyo ng gamot? May naisip pa ba kayong gamot para sa high blood? Metoprolol, yun, sa beta blockers natin ipapasok yun. Okay, epekto ng mga beta blockers. Dito, ang dami, oh. Kaya nga gamit na gamit ang beta blockers sa high blood. Atorvastatin, actually, atorvastatin class is not used for hypertension per se. Pero, one of the causes of hypertension. Okay? Kasi atherosclerosis, di ba sabi natin, it's caused by fat deposits. Dito papasok si atorvastatin. Para maiwasan natin yung formation ng atherosclerosis, maiwasan yung pag-form ng fats causing artery occlusions, which could, of course, increase peripheral vascular resistance, leading to increase in your blood pressure. Okay? So, atorvastatin is not for hypertension per se. Okay? Para yun talaga sa fat deposits eh. Pero it helps. Atorvastatin can help prevent further complications of hypertension. Okay? Meron pa ba kayo ibang naisip? May isa pa akong naisip. Okay? Another drug class is spironolactone. Lisinopril is an ACE inhibitor. Okay? Dito yan papasok. Right? It's ACE-I. So, blocking ACE inhibitors, preventing the conversion of angiotensin 1 to angiotensin 2. Right? The other drug class is spironolactone. Spironolactone class is an aldosterone antagonist. So, ang target niya ay ito. Okay, so it prevents water retention. And just so you know, class, spironolactone is actually classified then as a diuretic. Okay, hydrochlorothiazides, furosemide, these are medications class that are classified as diuretics. Right, so pretty much class, this is how you manage basically hypertension. So because we already understand, kaya napaka-importante class sa pharmacology, especially pharmacology to ha, napaka-importante dito class na may naiintindihan natin yung pathophysiology ng sakit na tinitreat natin. Okay, kasi pag naiintindihan natin yung pathophysiology niya, kung paano nagpo-progress yung sakit, ano yung mga causes ng sakit, naiintindihan din natin class kung paano gumagana yung mga gamot. Okay? Okay. So sige, pag may naisip pa ako mamaya, balikan ko kayo dito. Then let's go back to our slides. Balikan muna natin yung slides natin. From current slide. Okay. Right. So first drug natin dito class would be beta blockers. So kung naalala nyo pa class, sa ating, tawag dito, if you still remember in our ANS drugs, right, sa first lesson na binigay ko sa inyo, hope you were able to, to internalize. Okay? Just so you know, class, yung exams ko kadalasan, hindi nawawala ang ANS. Okay? Sympathetic, parasympathetic nervous system. Pati ANS drugs. Kasi sa buong cardiovascular system, class, mababanggit at mababanggit ko sila. Anyway, so di ba beta-1 receptors kasi, class, are drugs, are receptors that can increase heart pumping and at the same time causes renin release. So by using beta blockers, class, pinapababa natin ang heart rate. At the same time, pinapababa ang renin. Okay? What about the angiotensin 2 receptor blockers? Okay? If you remember, class, sabi natin, si angiotensinogen is converted to angiotensin 1 by renin. Okay? And angiotensin 1 is converted to angiotensin 2 by ACE. Okay? Ang angiotensin 2, ito yung maraming epekto sa katawan natin. Pero basically, class, by blocking the angiotensin 2 receptors, right? At dito papasok si losartan. Pangit nung ano dito Basta si losartan ito. Okay? By blocking yung angiotensin 2 receptor blockers, nawawala yung epekto ng angiotensin 2. Now, what if I block naman the ACE enzyme? Pwede yon. Gagamit ako dito ng mga prils. Alright? Prils. Ito yung captopril, lisinopril, enalapril, so on and so forth. Na pwede kong maiwasan yung formation ng angiotensin 2. Ang problema nga lang kasi, class, with ACE inhibitors is that kapag na-block ko yung ACE, right? ACE enzyme kasi, class, siya rin yung dahilan kung bakit nawawala si bradykinin, substance P, and enkephalins. Pero dito tayo kay bradykinin. Okay? Ano kaya ito matatanggal? Anyway, hamon na nga dyan na eh. Okay, si bradykinin class. Si bradykinin kasi class is a inflammatory mediator. Ito yung nagkakos ng coughing. Bradykinins can cause coughing. Now, isipin nyo to, gagamit ako ng lisinopril. Alright? Pag gumamit ako ng lisinopril class, iba-block niya si ACE. Pag na-block si ACE, tumataas yung bradykinin levels ko. Okay? Tumataas yung bradykinin levels. Pag tumaas ang bradykinin levels class, it induces coughing. Kaya nga, di ba, ano ang common side effect na associated sa ACE inhibitors? Anyone? Ano yung common side effect na associated kay ACE inhibitors? Captopril, enalapril, lisinopril. Okay, ano madalas na reklamo ng mga pasyenteng gumagamit nito? Sorry, aware na ba kayo, class? Okay, I'm assuming kasi na nadaanan nyo na to. Okay, sige, never mind. Alright? Common side effect kasi, class, associated sa mga ACE inhibitor is coughing. Okay, dry cough. Kaya kadalasan, kapag ang pasyente mo ay naka-experience ng dry cough, anong binibigay natin? Papalitan sa ACE inhibitor. Papalitan mo siya ng, angiotensin 2 receptor blockers. Kasi ang ARBs, kahit papano, wala siyang dry coughing. Pero sa panahon ngayon, class, kadalasan, hindi na nga tayo naglalysinopril. Diretso na agad, dosartan. Okay? Anyway. At again, ang dahilan doon ay yung substance, yung bradykinin. Okay, so sino-sino yung mga beta blockers natin? So we have the selective beta blockers. Okay, you have atenolol, esmolol, acebutolol, metoprolol. Okay? Nawala dito si bisoprolol. Okay? Anyway, it's kasi nebivolol. Pero anyway, yun. These are just some of the drugs class that are beta-1 selective. Sama dito si bisoprolol. Kasi class, ang mnemonis ko lagi dito is BEAM. Okay? Actually, sa alipan natin dito, celiprolol at nebivolol. Okay? Kaya ang mnemonis ko dito is BEAM. So, celiprolol, nebivolol, bisoprolol, esmolol, acebutolol, atenolol, at saka metoprolol. Okay? For the non-selective beta blockers naman, we have propranolol, timolol, nadolol. Kadalasan ng mnemonis ko dyan ay TPN. Right? Or total parenteral nutrition. So, timolol, propranolol, pindolol, sama mo na rin dito, at saka sinadolol. Right. Beta blockers with intrinsic sympathomimetic activity, or ISA. Ito class yung mga beta blockers na kayang i-activate si alpha-1 receptors. Any drug class with ISA can activate alpha-1 receptors. Now, you might be thinking, sir, pag inactivate ko yung alpha-1 receptors, di ba nagkakos yan ng elevation in BP? Tama ka dun, class. Alright? Kaya pag gumamit ka ng acebutolol or carpindolol class, these are drugs that can block beta-1 receptors but activate alpha-1 receptors. Now, anong advantage nito? Okay, anong advantage ng mga gamot na to? Acebutolol, pindolol. Okay? Ang advantage nito, class, is pag na-activate ang alpha-1 receptors mo, ang tendency, class, is hindi ganun kabilis bumagsak ang BP mo. Okay? Question, class, anong mas delikado? Mataas na BP or mababang BP? Alin ang nakakamatay? Mas nakakamatay. Pare-plus na nakakamatay, pero alin ang mas nakakamatay? Mababang BP or mataas na BP? Which one is more dangerous? Hypertension or hypotension? Alright, Mr. Dio? Very good. It's very good, Mr. John. Okay, mas delikado, class, ang hypotension. The problem, class, with beta blockers is they are so effective at reducing your blood pressure to the point, class, that it can induce hypotension. Now, if your patient is an elderly patient, okay, very sensitive sa reduction in blood pressure, delix, nabigyan mo siya ng beta blockers na purely beta blockers. Okay? Kaya kadalasan class kapag matanda, bibigyan mo ng beta blockers, usually you give them with beta blockers with ISA. Kasi class, because of the ISA here, papataas ng BP yan. Pero konti lang. Hindi naman ganun ka-significant eh. At least, ang nangyayari sa BP ng pasyente ko, hindi agad-agad babagsak. Dahan-dahan lang siyang babagsak. Okay, uti ko class, sobrang effective ng beta blockers magpababa ng BP. To the point na sobrang effective naman niya. Okay? Kaya ideal class yung mga beta blockers with ISA sa mga elderly patients. Okay? Problema lang sa mga gamot na to, mahal sila. Okay, they are quite expensive. So next one, beta blockers with alpha-1, with alpha blocking capacity like labetalol or carvedilol. Ang advantage naman class ng mga gamot na to is there is a decrease in, no increase in LDL. Hindi siya nagpapataas ng low density lipoproteins natin. The problem kasi class with beta blockers, okay, in general, especially beta-1 blockers, nagpapataas sila ng cholesterol levels. Alright? If you use labetalol and carvedilol class, these are medications that do not have the capacity to induce or to increase LDL levels or cholesterol. So it's very good. It's a good drug class for people with hypercholesterolemia. Okay? Mataas ang cholesterol. Butoxamine, hindi naman ito ginagamit, pero just so you know, it's a beta-2 selective blocker. Wow! Sumobra ako. Okay. Next one, angiotensin 2 antagonist. Ito yung sinasabi natin mga gamot that blocks angiotensin 2 receptors. So, any drug that ends in sartan. Valsartan, losartan, telmisartan. Okay. Saralasin lang class ang tanging ARBs that does not end in sartan. Right? Valsartan. Question class. Ano sa tingin yung pinagkaiba ni valsartan, kay losartan, kay telmisartan? Okay, sige, anyway. Most likely, baka ninyo pa ito alam. Pero kasi ang pinagkaiba lang ng losartan, kay valsartan, kay telmisartan, ay kadalasan sa kanilang salt forms. Okay? Pero efficacy-wise class, wala sila halos pagkakaiba. Okay, pwede kasi yung isa dyan, matagal lang bago ma-absorb. Alright? Kumbaga, delayed lang yung niya. Kumbaga, mas convenient yung dosing ng iba. Pero generally speaking class, walang pagkakaiba in terms of efficacy si losartan, kay valsartan, kay telmisartan. Okay? Kaya kadalasan, ano ang nireseta ng doktor natin? Losartan. Kasi yan yung pinakamura eh. May napaka-negligible na halos ng difference niya kay valsartan sa kay telmisartan. Okay, not unless a patient has allergies to certain components of losartan that you might want to transfer them or shift their treatment to telmisartan or valsartan. But otherwise, class, they're all the same. Their efficacy is the same. Same goes with mga ACE inhibitors. Halos lahat yan, pare-pareho lang. Okay, kaya lang naman class pinalitan ng mga doctors yung kanilang mga salt form ay para sa patents. Okay? Sorry, not doctors, but manufacturers. Okay, basta class ACE inhibitors, anything that ends in pril. Hindi natin pag-uusapan class yung difference ng bawat isa na yan kasi lahat yan, iisa lang ang MOA. They inhibit ACE enzymes. Now, ulitin ko class, ano nga ba ulit ang side effect associated with ACE inhibitors? Ano nga ba yung side effect na yan? Okay. Ano yung common side effect with ACE inhibitors? Na nabanggit natin kanina? Cough. Very good, Miss Fleury. Okay? Yung dry cough. At yung dry cough na to is because of increase in bradykinins. Bradykinins class are pro-inflammatory cytokines. Okay? Now, class, yung increase in bradykinins na yan can bring about dry cough. Pero not only dry cough, class, it can also cause angioedema. Angioedema, wait, try natin dito. Okay. Angioedema class is something like this. Yan. Okay, namamaga yung mata. Common ito class na makikita nyo pag nag-allergy ang isang pasyente. Correct? Okay, so class, kapag gumamit ka ng ACE inhibitors, isa sa mga major side effect niya is, yan, it can cause puffiness of the eyes. Because of, ano yan? The pro-inflammatory cytokine, which is bradykinin. Okay? Yan. Sorry. Alright, so clinical uses of angiotensin antagonists. So ACE-ICE, madalas na ginagamit for hypertension. Pwede rin gamitin for CHF and diabetes. Actually, class, if you have diabetes and have hypertension at the same time, drug of choice is either ACE-ICE or ARBs. Normally, class, ang ARBs nire-reserve for patients who cannot tolerate ACE-ICE. Okay? Kasi mas mahal ang ARBs kaysa kay ACE-ICE. Kaya usually, kapag hindi mo kayang tagalan si ACE-ICE, saka ka lang bibigyan ng ARBs. Pero nowadays, dahil off-patent na, wala nang patent si losartan, anyone can afford na losartan. So, madalas, diretso na tayo dito sa ARBs. Okay? Okay. Now, what about for diuretics? So, sabi natin class, diuretics are basically used to reduce blood volume. Alright? So, meron tayong loop diuretics, thiazides, and potassium-sparing diuretics. For loop diuretic class, of course, ang pinakasikat dyan would be furosemide. Okay? For thiazides class, ang pinakasikat dyan would be chlorothiazide. Or dito rin naman ng guys, HCTZ or hydrochlorothiazide. Okay, amongst the potassium-sparing diuretics class, we have spironolactone, which is the most popular one. Other diuretics we have are the carbonic anhydrase inhibitors like acetazolamide, dorzolamide. Okay, ang problem with this one class, with carbonic anhydrase inhibitors, is that it causes, meron pala akong separate slide for this one. Sige lang. Okay, this one naman class causes metabolic acidosis. We will explain this pala in a while. Osmotic diuretics, pinaka-popular dyan would be mannitol. Okay? Now, hindi lang to class ideal na ginagamit to reduce blood pressure. Actually, hindi naman to ginagamit to reduce blood pressure. Kadalasan ang mannitol class ginagamit to reduce intracranial pressure. Okay, ito class yung pressure nagbe-build up kapag nagkaroon ng concussion ang isang pasyente. Okay, halimbawa namamaga yung utak. Right? Pwede mong bigyan ng pasyente class ng mannitol para mawala yung pamamaga na yun. Or mabawasan yung fluid build up sa loob ng utak ng pasyente. Excuse me. Next one is xanthine diuretics. For xanthine diuretics class, popular dyan would be caffeine. Pansinin nyo class, every time na magkakape ka, maya't maya maiihi ka. Same goes with theophylline na madalas makikita sa tea. Theobromine naman class, ito yung component or alkaloid na makikita nyo sa chocolates. Okay, so all of these things can induce diuresis. Ito class, mga hindi na ito ginagamit. Just so you know. Kaya hindi ko nababanggitin sila. Pero they were once used as diuretics. Okay? So here are some of the diuretic agents and their target sites. Like halimbawa, proximal conjugated tubules. Okay, ba't ba yan ang pinapakita ko sa inyo? Dito na lang tayo. Right? Ba't ko pa ipahihirapan? So, ang target class ng ating diuretics ay ang nephrons ng ating kidneys. So, each nephron class contains a glomerulus. This is one nephron. Alright? This whole thing is one nephron. Okay? Sa ating kidneys kasi class, each kidney is composed of millions of nephrons. So, let's just discuss one nephron. Right? So, this one class is what we call the glomerulus. Okay? Ito naman yung area to is known as the Bowman's capsule. Sige, hamon na yun. Basta tatandaan nyo lang dito, class, dito dumadaan yung tubig natin upon excretion. Normally, class, okay, normally, pag nakita mo yung, tawag dito, nakita mo yung arrow na to, I don't know if you can see this, these arrows, ang pangit kasi ng, ba't kaya nagaganito yung ano ko? Anyway, yan. Yung sabihin, nag-excrete yung segment na yan ng nephron ng certain compounds. Like, halimbawa, for the proximal straight tubule, the PST, okay, dito sa parte na to class, ito yan, mula dito, proximal conjugated tubules, Okay? Sa proximal conjugated tubules natin, lumalabas yung sodium bicarbonate, sodium chloride, water. Okay? Lumalabas sa kidneys natin. So, it's being excreted. Right? Na pagdating naman class dito sa thin descending limb, right? So, sa may loop of Henle class, dyan lumalabas ang tubig natin. Okay? Now, here class ang pinaka-importante. Or, I won't say pinaka-importante, pero maraming electrolytes na nangyayari na lumalabas. Okay? Lumalabas dito si potassium, calcium, magnesium, sodium, and chlorine sa may loop of Henle. Specifically sa thick ascending limb ng loop of Henle natin. Okay? Ito ang tatandaan natin, class, ha? Kung nasan si sodium, sumusunod lagi si water. Right? Wherever sodium goes, water follows. So, if sodium goes out of the body, anong gagawin ni water? Si water lalabas din sa katawan. Okay? At dito sa may loop of Henle class, maraming electrolytes ang lumalabas. Included din dyan siyempre si sodium. Okay? So, pag lumabas si sodium here class, okay, it causes, it causes your water to move as well. Okay? So, if you notice class number 3 yan, right? Yan ang pinaka-target ni furosemide. Okay? It causes class the release of sodium, magnesium, okay, and so on and so forth. A lot of electrolytes class can be removed by furosemide. Right? So, pag nilabas yan ni furosemide, lalabas din yung water. Okay? Okay. So, yun class, for loop diuretics, it simply blocks the sodium, potassium, chlorine importers in the thick ascending loop of Henle. Okay, by blocking this class, it prevents the reabsorption of these electrolytes. Ang pinaka-target talaga natin dito class is sodium. Tatandaan natin 'yon. Okay, kasi class sodium ang electrolyte na madalas na nilalabas ng mga diuretics natin. Siya ang pinaka-target ng diuretics natin. Okay, for thiazide diuretics naman, they remove sodium and chlorine. Okay, they block the reabsorption of sodium and chlorine, thus preventing sodium from being reabsorbed. So pag hindi pumasok hindi na reabsorb si sodium, hindi rin na-reabsorb yung water natin. Thus, hindi tumataas ang blood volume. Okay, for potassium sparing diuretics class, the thing with this is pinapalabas niya si sodium. Okay, it inhibits the sodium influx. Okay? But na-spare si potassium. Okay? Kaya madalas class, kapag gumamit ka ng potassium sparing diuretics, bababa ang sodium levels, pero tataas si potassium. Kaya nga siya tinawag na potassium sparing diuretic. Excuse me. Now what about class carbonic anhydrase inhibitors? They block the reabsorption of sodium bicarbonate. Now, try lang natin class, ano ang purpose ni sodium bicarb sa katawan natin? Okay, sodium bicarbonate class is a buffer. Shucks. It helps neutralize acids in the body. Now, pag gumamit ka ng carbonic anhydrase inhibitor, nawawala yung sodium bicarb. Pag nawala yung sodium bicarb, walang mag-neutralize ng acids natin. So, ano nangyayari sa katawan natin? Nagkakaroon tayo ng acidosis. Okay, kaya yun isa sa mga significant side effects associated sa carbonic anhydrase inhibitors. Okay? Okay. So, for thiazides class, kadalasan ginagamit siya for hypertension, mild heart failure, ginagamit siya for chronic calcium stone formation. Okay? Ang reason for this one class is, thiazide diuretics are calcium sparing. Okay? It spares calcium. Now, class, saan pinapapunta si calcium? Pinapabalik siya sa blood. Okay? The thing kasi class with calcium stone formation is, nagkakaroon ng calcium stone formation kung ang calcium ay nasa wiwi. Right? By using thiazide diuretics class, yung calcium na dapat nasa wiwi, pinapabalik sa blood. So, nawawalan ng calcium sa wiwi. Right? Parang think of it this way, class. If this is your kidneys, sabihin natin ito yung blood vessel. Kapag si calcium ay nandito sa kidneys, okay, it causes calcium stone formation. Anong ginagawa ni thiazide? Si thiazide class, pinapa-reabsorb yan pabalik sa blood. Sabi niya, kayo mga calcium, balik kayo dito sa dugo. Okay, so anong nangyayari sa calcium sa kidneys? Kumukonti. So therefore, hindi lumalaki. Kung meron ka mang calcium stones dyan, hindi yun lalaki. Kasi nga, ang ginawa ng thiazide diuretics is, pinabalik niya lahat yun sa bloodstream. Right? For loop diuretics, kadalasan siya ginagamit for CHF, cirrhosis, and nephrotic syndrome. Okay? So what are some side effects that we can attribute to furosemide? Furosemide class can cause hypo of everything, of every electrolyte in the body. Hypokalemia, hypocalcemia, and so on and so forth. Hypomagnesemia. Kasi nga, ang target niya is yung thick ascending loop. Now, another side effect class associated with furosemide is it causes hyperuricemia. Hyperuricemia, which is often classed a predisposing factor for gout. Okay? So, yung gout class, yung pain in your joints. And not only that class, furosemide can also induce ototoxicity. Okay? So, it damages your ears. What about for chlorothiazide? Okay? It can cause hypo of everything except calcium. Causes hypercalcemia. Why? Because it spares calcium. Alright? Ang problem lang din class with chlorothiazide is that it can cause hyperuricemia as well, on top of hyperglycemia and hyperlipidemia. Kaya class, ito ang tatandaan ninyo. Kapag ang pasyente mo ay may diabetes, kadalasan hindi tayo mag-recommend ng chlorothiazide. Bakit? Nag-i-induce kasi siya ng hyperglycemia. So chlorothiazide is not ideal for diabetic patients. So are we clear? Okay, I've seen so many diabetic patients class taking hydrochlorothiazide only to find out class na hindi bumababa ang kanilang sugar kahit na anong gawin nila because nga they are on chlorothiazide. Right? So that's one thing class you have to remember. If a patient has has diabetes and hypertension, it is not advisable to give chlorothiazide. Kadalasan pag ganyan ang situation, binibigyan natin ang patient natin ng binibigyan natin siya ng ACE inhibitors. Mas ideal sa kanila yun. Okay? Next one, spironolactone. Okay, it's a diuretic class, nagpapababa ng blood volume, but it spares potassium. So what are the side effects associated with spironolactone? Kadalasan class, it causes impotence or gynecomastia. Okay, loss of libido and hirsutism. Gynecomastia class is yung nagkakaroon ng boobs yung lalaki. Normally class, pag nagkakaroon na ng gynecomastia ang isang lalaki, right, ang alternative class for spironolactone is eplerenone. Eplerenone class is an ideal drug used to as an alternative to spironolactone if a patient is experiencing gynecomastia. Okay? I hope hindi nyo ito makakalimutan. These are high-yield questions, especially in my quizzes and exams. Okay? Mahilig ako magtanong ng mga alternatives. Okay. Yeah. Alright. Now, what about for vasodilators? Okay? For vasodilators class, we have the CCBs, or calcium channel blockers. Specifically yung second generation. We have the arteriolar vasodilators, meaning these are the vasodilators that dilates arteries. And then we have the arterial and venous vasodilators, meaning these are vasodilators that can dilate both arteries and veins. Okay, before I proceed class, sa tingin nyo, amongst the blood vessels class, sino yung blood vessel na pag dinilate ko, mas bababa ang BP ko? Arteries or veins? Okay, anyone? Ulitin natin. sino sa dalawang arteries class, sino sa dalawang blood vessel class ang kapag dinilate ko, mas bababa ang BP ko? Is it the arteries or the veins? Very good, Mr. John. Actually, yung arteries. Okay? That's not a question mark. Okay? So that's very true. Arteries class, ito mga arteriolar vasodilators, ang pinakamabilis magpababa ng BP. Kaya between the two class, arterial direct vasodilators versus the non-selective, sino ang safest sa tingin nyo? Sino ang safest gamitin? The selective, the direct, or the non-selective vasodilators? Sino ang safe gamitin? Between the two. Is it the direct vasodilator or the non-selective vasodilator? Sino yung safe gamitin? Okay, sige. It's okay. Class, mas safe gamitin itong non-selective. Bakit? Kasi class, si direct, talagang arteries lang ang dinadilate niya. For the non-selective kasi class, not too much on the arteries, but more on the veins. The venous. Okay? So, between the two class, mas delikado gamitin itong tatlong ito. Okay, kesa sa dalawang ito. Kaya kadalasan, makikita nyo yung ginagamit natin, pampababa ng BP ay mga gamot na ito. Okay, so here class, we have examples of the intrinsic vasodilators that we have in the body. Normally class, nagkukos ng vasoconstriction ang endothelin 1 or stimulation of your alpha receptors, specifically the alpha 1. Woo! Nakakainis naman tong ano ko. Anyway, so class, ang endogenous vasodilators natin, or ito yung natural vasodilators ng katawan, ay nitric oxide, prostacyclin, adenosine, beta-2 stimulation, and so on and so forth. So these are the natural vasodilators. Now, what are drugs that can release nitric oxide, which is a natural vasodilator? We have the drugs class hydralazine and nitroprusside. Okay. What about drugs that can induce hyperpolarization? Okay. By opening potassium channels. So by opening potassium channels class, nag-hyperpolarize yung ating cells. Alright, meaning nagre-relax sila. And an example of those drugs would include minoxidil and diazoxide. And then class, for calcium channel blockers, they block the L-type calcium channels naman. Right? Okay. So for the calcium channel blockers class, we have the first gen versus the second gen. Ang first gen class, these are CCBs that can reduce heart rate plus induce vasodilation. Second generation, on the other hand, class, these are dihydropyridines and they only vasodilate. Okay? They only induce vasodilation. Kaya between the two class, mas safe si second generation kaysa kay first generation. Kasi si first generation class, talagang significant yung pagbagsak ng BP. Kasi aside from vasodilating, it also reduces heart rate. Kaya most of the time class, ang first generation, ginagamit ito for arrhythmias. Okay, like diltiazem and verapamil. Pero for the second generations class, ito yung madalas na ginagamit for use for hypertension because it is safe. It is relatively safer to use. Right? Now, ang palatandaan natin class sa mga second generation beta calcium channel blockers are any drugs that ends in dipin. Okay? Dipin. Are we clear? Now, one thing class na gusto ko maalala dito is nicardipine. Nicardipine kasi class is the DOC for hypertension crisis. So are we good? Okay. So yun ha. Nicardipine is the drug of choice for hypertension crisis. Amlodipine class is the most commonly used for Hypertension. Siya ang cheapest eh. Okay? So sabi ko nga class, with the first generation, they tend to have the ability to reduce heart rate and induce vasodilation. Compare that class to second generation calcium channel blockers, which are vasoselective. Okay, so they produce a depressant effect on the vessels than in the heart. Clinical uses are for hypertension, obviously, and then we can also use it class for angina pectoris. Supraventricular tachycardia class are also known as atrial fibrillation. Okay, kadalasan ginagamit yung verapamil diltiazem, pero they are said to not be approved for these conditions. Okay? So other uses class, pwede rin siyang gamitin for migraine, preterm labor, stroke management. Alright. And for its adverse effect, common dito class ang, asa na yung edema, pretibial edema for CCBs. Alright? Okay. So what about minoxidil? Is everyone aware of what minoxidil is? May brand name to class eh. Hindi natin siya ginagamit for hypertension ha. Okay, pero it's well known as the drug Regrow. Familiar ba sa inyo yung gamot na to? I actually used this before. Regrow. Okay? Okay. Regrow class is a hair growth formula. Okay, pampatubo ng buhok. Okay, yung minoxidil. So, originally class, minoxidil was designed for, what do you call this? It's designed for vasodilation. Pero it was found out that it can induce hirsutism. Kaya ang ginawa sa kanya class, instead na gamitin siya as vasodilator, mas kikita daw yung drug company kapag ginamit siya as hair growth formula. Okay? So, here's something class that I want you to take note of. It causes reflex tachycardia. Okay, I'll discuss this in a while. Right? What about hydralazine? Okay, one of the main side effects associated sa kanya is lupus-like syndrome and also reflex tachycardia. Okay? Okay. So, class, one of the things that you'll notice about vasodilators, okay, specifically arterial vasodilators, is that they can cause reflex tachycardia. Okay? Ganito kasi yan, class. Di ba sabi ko sa inyo, mas delikado ang arterial vasodilators compared to other vasodilators because mabilis sila magpabagsak ng BP. Okay? Now, kapag kasi class biglang bumagsak ang BP mo, magre-react yung katawan natin. Okay? Nagre-react siya class, sabi niya, hala, ba't biglang bumabagsak yung BP? Okay? Delikado ito ah. So, magre-react class yung katawan natin to help counteract the sudden drop in BP. At paano nagre-react yung katawan natin? Okay? It induces class what we call reflex tachycardia. So, because there's a sudden drop in BP due to hydralazine, nag-respond ang katawan ko by inducing tachycardia. Now, class, ano ang gagawin ng tachycardia sa BP ko? Tataas or bababa ang BP ko pag nagkaroon ako ng tachycardia? Anyone? Pag nagkaroon class ng tachycardia, ano ang mangyayari sa BP ko? Tataas or bababa? Very good, Mr. John. Okay? It causes an increase in BP. Para ma-counteract yung pagbagsak ng BP due to the use of hydralazine. Kaya kasi yung reflex tachycardia na to, kaya siya tawag na reflex. It's in response to the sudden drop in blood pressure. Yun nga lang, class, ang problem lang dyan is kapag nagkaroon ka ng tachycardia, di ba ang sakit sa dibdib? And it can, ito effect ito eh, it can cause angina or chest pains. Reflex tachycardia kasi can result to chest pain. Okay? Okay. Now, what about class sodium nitroprussides? Okay, sodium nitroprusside class, okay, one of its metabolic byproduct if exposed to light is cyanide. Kaya madalas class, hindi na tayo gumagamit ng sodium nitroprusside. I haven't seen this in the hospital anymore. Okay, dati itong drug of choice for hypertension crisis, pero nowadays ginagamit na lang natin is nicardipine because it's a lot safer. Kasi sodium nitroprusside, ang problem sa kanya nga is, pag na-expose siya sa light, once exposed to light, it becomes cyanide. And cyanide class, as you all know, is a poison. Okay? So cyanide is rapidly converted to thiocyanate, which leads to thiocyanate toxicity. Okay? And normally, its class thiocyanate toxicity is often manifested or characterized by the following symptoms: weakness, psychosis, muscle spasms, convulsions. Right? So kaya class, delikadong gumamit ng sodium nitroprusside, especially sodium nitroprusside that is not kept well. Okay? Kasi again, pag na-expose siya sa light, kadalasan it becomes cyanide. Okay? Try lang natin. Ano antidote for cyanide poisoning? Anyone? Sige. Okay, it's methylene blue. Right? Methylene blue yung ating this antidote for thiocyanate or for cyanide toxicity. Okay, what about for the azoxide? Again, see, causes reflex tachycardia. Okay. Now, what are some well-known drugs that are associated with hypertension? So meaning, ito yung mga gamot na alam nating nagkakos ng high blood. Alcohol use. Alcoholic tend to be hypertensive. Amphetamines or cocaine, obviously, because these are stimulants. Dahil stimulants sila, nagpapataas sila ng BP. Steroids, because of the sodium retention. Sodium retention, which causes water retention, which causes an elevation in blood volume. Decongestants, because these are, what you call this, vasoconstrictors. Ito kasi ang pinakakaaway natin talaga pag may high blood NSAIDs. Because class, especially, NSAIDs that can block COX-1 and COX-2. Why? Kasi class, COX-1 is a natural vasodilator. If I block this, wala na akong vasodilator. COX-2 naman is a natriuretic peptide. Meaning it causes sodium. COX-2. So pag tinanggal ko si COX-2, na-inhibit ko using my NSAIDs, tumataas si sodium. At pag tumaas si sodium, tumataas si water, which causes an increase in blood volume. Nicotine is a vasoconstrictor. At yung oral contraceptives naman class, okay, ito naman daw kasi, it causes an increase in angiotensinogen. Right? Alam naman natin class, pag maraming angiotensinogen, pwede silang ma-convert to angiotensin 2. Which is, well, alam natin kung anong pwedeng mangyari. Right? Could lead to a lot of problems. Alright? So, what are the choice of antihypertensive drugs based on patient characteristics? So, kadalasan daw class, if a patient has diabetes, diabetic patients and those with chronic kidney disease, normally angiotensin antagonist ang ginagamit natin. Okay? ARBs or ACEs. If a patient naman has coronary artery disease, CAD stands for coronary artery disease. Okay, maganda gamitin dyan, beta blockers, CCBs, and avoid hydralazine. Obviously, because of the reflex tachycardia. Pero, class, we don't use hydralazine anymore. You can no longer see this in guidelines. Congestive heart failure, maganda gamitin dyan, ACE inhibitors, and of course, diuretics. Nako, eto class, dati avoid beta blockers, pero nowadays, we have to use beta blockers. Avoid lang ang calcium channel antagonists, calcium channel blockers. Okay, well, we use beta blockers here. Ideal na gumamit ng beta blockers. I'll explain this when we start discussing CHF. Okay? For athletes, you avoid beta blockers and diuretics because diuretics can cause dehydration, while beta blockers can prevent yung heart from pumping properly. Kaya kadalasan for athletes, bibigyan mo lang sila ng ACE inhibitors. Pero athletes normally don't have hypertension naman. Okay? Bronchopulmonary disease, calcium channel antagonist can be used. We avoid beta blockers because of its bronchoconstricting properties. Dyslipidemic patients, we try to avoid beta blockers and thiazides because they can increase cholesterol levels. If a patient has PVD, peripheral vascular disease, normally magandang gamitin dyan ang nifedipine. Okay, vasodilators or ACE inhibitors. We try to avoid beta blockers for this. And for people with end-stage renal disease, usually we give calcium antagonists. Okay? And some caution lang with the use of ACE inhibitors. For stroke patients class, mas ideal na gumamit ng ACE inhibitors and diuretics. And if the patient is elderly, be wary lang of pseudohypertension wherein there's an elevation in BP due to brachial artery atherosclerosis or which is not due to hypertension per se. Okay, pero usually class, pag elderly, gamit tayo ng diuretics, pero hydrochlorothiazide ang binibigay. Pero kung siya ay may diabetes, then we try to avoid that as well. Alright? Okay. And that is pretty much the last slide. Okay. Okay. And that's our discussion class for hypertension. Yeah. Okay. So this one's a more, what do you call this? Summarized form of our discussion. Hopefully, naintindihan naman tong graph na to or yung ating diagram na to. Okay? So, are there any questions, class? Clarifications or anything else regarding our discussion?